All right, it's 2:02 and we're going to get started. Welcome, everyone. Thanks for being here. This is the Aurora Health Alliance's winter quarterly community meeting, our first quarterly community meeting of 2026. And wanted to start off by saying thank you to our affiliates who are listed on this first slide here. We can do what we do because of them. So if you're interested in becoming an affiliate, let us know. But thank you so much to our current affiliates. We really appreciate your support. My name is Joe Glaviano. I'm the program manager with Aurora Health Alliance, and we're going to get started here. I will just give a quick overview. We'll have our panel of folks. We've got Kate and Giovanna with the Colorado Language Access Collaborative, and then Rory Franklin with Aurora Water, and then we will end with a pop-up survey. We will be asking you all, so start thinking about priority topics that you would like to suggest we cover this year. We do topical webinars throughout the year, and so we want to know from you what's top of your mind. I know there's a lot, I'm sure, but what really stands out the most and might be a good suggestion for us to focus on for a topical webinar. So we'll do an overview of our meetings this year, and then we'll also include a pop-up survey. So please be thinking about that. And with that, I'm going to stop sharing and turn it over to Kate and Giovanna.
Hello, everyone. Thank you so very much for inviting us, Joe, Mandy, and Bobby. Kate and I are here representing the what we call CLAC, C-L-A-C, but CLAC is easier for me. And it's the Colorado Language Access Coalition. So we are a group of very passionate advocates, supporters, of language access. And we came together a little bit of 4 or 5 years ago, and Kate can give you a better date in time, but I am pretty new to the group, although I was attracted by the passion and by the mission of being with like-minded people that, like you, in health. In our case, we can share about hurdles or challenges or unexpected turns that our communities face regarding access to services when language and cultures are a barrier. So we support public policies, and what that means is thanks to some of our members that are really connected to what is happening at the Capitol, but also at the national level, we bring it in as information, first of all, but we also receive it from our membership, information regarding any bill coming up or any policy, any violation that could create a topic of conversation for us. And we are a group that either offers information or offers not necessarily solutions, but strategies on how to face whatever is coming up. Kate, if you want to move along. The group right now accounts for about 150 members. So we represent almost 100 as organizations, if not more. We have a pretty flexible structure in the sense that we don't require mandatory attendance, but the attendance and the participation is pretty much based also on interest and availability. The format and the format is actually extremely well planned out. We all come from Colorado. We represent a variety of stakeholders, language service providers, community-based organizations, nonprofit organizations, but also government agencies. As I said, we educate, but we are also educated. So there are some of our meetings, gatherings that have as a focus to invite an expert in a specific subject topic, law, etc., to share with us the ins and outs of that topic. We have monthly meetings, but they feel a little bit more than just once a month because depending on the topic, depending on the interest, depending what is at hand, we also create some ad hoc meetings where a smaller group of members come together discussing specifics of a certain conversation or a certain theme. We do have, although the format and the structure is very flexible, we do have a steering committee versus the larger group. And the steering committee has the additional task to kind of present to the entire group what would be the plan for the next 6 months, for the next year, and kind of make everybody aware of what has been done, especially when we are at the end and the beginning of the year, what has been done through the year, what is pending, what was closed, and what is ahead of us for the next 2 years and the next year. We also invite our members to bring up information, to bring up issues that could be of interest. And again, they can either be because of a challenge or because of an interest for additional information and education. If you want to move on. Okay. These are an example of our meeting topics. So I browsed the AHA website and I find a number of different ways that can be looked from different perspectives, and so that we can align the way we work at CLAC and how you work at AHA. So I noticed, for example, that you have work groups. I noticed that you have the quarterly community meetings. You also have webinars on specific topics. It's a little bit what we also do. We just call it differently. And what we have focused on in the couple of years is plain language trainings, trying to make our members, but also our members knowledgeable about what plain language is so that they can be beacon of information, spreading the information in the organizations that they work for, so that information to our diverse communities becomes more accessible. We are very much informed and in tune with the lawmaking process. I need to, I need to give credit where credit is to be given. Kate is very good at keeping us on our toes on what is at hand. And she is actually the biggest connector of the coalition. It's a little bit the head or the tree trunk and the branches. We're the branches. I like to think of Kate as being the trunk. So she keeps us in lining, but everybody plays their part. So we have been involved recently with language access policy for state agencies at the state level. We also have learned a lot about the deaf and hard of hearing communities. We have had presentations. We have had some projects that have been presented to us where there could be an alignment in terms of coordinating some efforts, both on the spoken language side and on the ASL side, for example. We have also been exposed to national events, such as the U.S. Commission on Civil Rights, our response to the Executive Order 14224, the famous English as the official language executive order, but also the Department of Justice memo. CLAC has participated with others in responding to both. We are also part of the changes and the developments at the state level, at the legislative level for the language access here in Colorado. And some of us have participated at the interim advisory board that made the recommendations to the legislative branch, to the judicial branch, I'm sorry, regarding language access, interpreting, and translation services. So there is a variety. This is just a little bit of a sample of what we do. And I'll leave Kate go next, as she's going to go more in detail in terms of what we are going to present to you. Kate, the floor is yours.
Thank you so much, Giovanna. And I'm going to briefly post a few of the things that Giovanna mentioned in the chat here. If I can navigate my many windows. Um, just in case folks are sort of curious and interested to see some of the work that Giovanna mentioned around language access, and in particular, language access at the federal level, which has become more and more a part of our work. We sort of started in the state advocacy space a little more and have since evolved by necessity, as I think is true for many folks, to more and more advocacy in the federal space. So I'll put a couple links in the chat there that may be of interest to folks. And then let me move forward here. I won't go into a great amount of detail on these things because Giovanna covered a lot of this already, and it can get quite wonky. So if anyone is curious to connect afterwards and learn more about our past work or engage in CLAC moving forward, we would certainly love to connect and love to have you part of the group if you'd like. Um, a few things I would mention, and maybe moving back, Giovanna mentioned the history of CLAC. CLAC started as a formal group in August of 2023, so we've been around for a little more than 2 years. In the 2024 legislative session, which many of you probably know, Colorado's legislative session runs January to May, so it sort of happens condensed just this time of year. In 2024, we were involved in a couple language access related bills. One was this Language Access Advisory Board bill, which created an interim committee of sorts to discuss language access at the legislature. Giovanna was part of that committee. And in the chat, you'll see a link to the recommendations report that came out of that committee. There was also a bill that year that focused on the licensing process for childcare providers. So childcare providers can now in the state of Colorado go through the whole licensing and training process through the state in either English or Spanish, depending on their preference. And then we did, and we try to do this every year, have some in-person gatherings, including when we're able to have sort of meet and greet opportunities with legislators so CLAC members can connect with the legislative allies that have been supportive of our work. Last year in 2025, there was one bill that we were primarily focused on. Giovanna alluded to this. This was a bill that directed an assessment of language access practices at state agencies. That assessment will actually be happening this year and should be going sort of starting and coming underway very soon. As linked in the chat and as mentioned by Giovanna, we did put out some statements related to an executive order that President Trump signed in March, as well as a memo that the Department of Justice and Attorney General Pam Bondi put out in July. And we have also engaged with folks in state government to provide input from the CLAC group on language access policy at state agencies and other issues. And we also, and I will link this in the chat as well, we published last May a language access policy recommendations report, which was provided to the folks creating that policy at state agencies, but also circulated more widely, and you're welcome to circulate that as well. The last thing I would say here, and then I think I'll wrap up so we can turn it over to Rory and leave time for questions, is that I know a lot of these pieces here are advocacy oriented, which is, of course, a big part of our mission. But we do want to make clear that we understand that not everyone is able to engage in advocacy in the same way because of their role. And we welcome all types of participation. So the way that we structure things is if we have a statement or if we're endorsing a bill, it is then followed by a list of the specific members who have opted in or signed on to endorse that specific statement or bill. So we have a lot of CLAC members who can't do that necessarily, can't add their name or their organization name, but are still involved in our meetings and still participate in other ways. So looking forward to 2026, we're going to continue to prioritize a lot of the things that we have already been working on, and we'll continue to watch how things evolve at the federal level. We recently endorsed a bill in the US Congress related to language access, which will not have the legs politically to make it through, but does hopefully have the potential for impact just by sort of raising the issue and naming it and educating legislators around what language access is. So I'm going to pause there and turn it back to you, Joe, if we want to do questions now or pass it to Rory. But again, big thank you to everyone for joining. And I know another of our steering committee members was maybe going to hop on today. Oh, I see them. Yes, Val is also here. So Val, when we get to the Q&A section, please feel free to jump in and add anything else that you would share in addition to what Giovanna and I presented. So back
Thank
to
you,
you, Val.
Kate.
Yeah, thank you, Val.
Yeah, thanks, Kate and Giovanna. I think that if anyone has some initial questions or comments, we can take a couple minutes and address those.
Kate and Giovanna, thank you so much for your presentation. I was just curious if there's anything additional that community-based organizations or healthcare organizations can do to support your work. Is that by joining meetings or sign-on letters during advocacy season, etc.? Just wanted you to have the opportunity to ask all of these folks on any ways we can support you.
I can get us started and then Kate can fill in. It all depends on where we are, right? What we do already internally with our organizations. I think that as we connect more and more, the most important level of coordination that we can do is to share information. Example, this needs assessment is coming up. One of the efforts that we anticipate we are going to be focused on is how to try to include as many as possible. And so having the ability to connect with other community-based organizations, other offices in the health space as well, will give us a little bit more of exposure, not only in terms of information, this is happening, why is happening, and why it's important to get feedback. We need to recognize and we need always to keep in mind the fact that when these needs assessments happen for language access, we need a good representation of the communities that need these services rather than us English speakers speaking on their behalf. We need their storytelling, then we need their experiences, and we need to understand also from their standpoint what works and what does not work. We do not want to fix something that works, and we want to try to improve and keep in mind of what is still has to be improved.
Yeah, definitely. I would agree with all of that. And I don't know how helpful this is, but I so appreciate the question, Mandy. I think maybe sort of the immediate thing that comes to mind for me may sound very simple, but just any way that you're interested in, I know you, for example, are, already plugged into some of these spaces, but interested in plugging in and just sort of tracking what's happening. I think even for folks who say can't attend monthly CLAC meetings, we do send information out via email, and that's a good way to track opportunities to engage. So if we have like a sign-on letter that CLAC has written, or if there's a bill that folks can endorse as an organization that CLAC is involved with, we will flag that both in our monthly meetings and via email at different points. And we are always so grateful for folks bringing in expertise in other spaces. Like CLAC is quite a diverse group. It's not just folks who are, narrowly focused on policy or narrowly focused on language service provision. It's like a smattering of folks from all different spaces, including the health space. And we would love to welcome anyone else from the health space to join us and, teach us all the things that we don't know about the health space and health service and health policy, et cetera. So I will drop my email in the chat if anyone is interested in joining CLAC or just learning more or, even joining our steering committee. We would certainly welcome that as well. We would love it. Yeah. And I will also put in the chat a link to some flyers about the group, which you're welcome to disseminate to coworkers, partners, community, etc.
Great. Thank you both so much. We really appreciate it and appreciate the work and momentum you've built in just a short amount of time. So thank you.
And one last thing that I would like to add is we also leverage our expertise internally. And so when there is a topic of interest that is related to language access or translation or interpreting, or some of our community-based organizations wanted to learn more about what is a language proficiency assessment, etc., feel free to reach out to us in case one of your webinars would like to learn more about these topics. And I believe that you can be also a resource for us if anything comes up on the policy side that requires a little bit more of information as per what happens in your world to educate us more.
Great. Thank you. That's great. Thank you. All right. Up next, we have Rory with Aurora Water.
Right. Well, thank you everybody for joining me today as I talk a little bit about Get to Know Aurora Water. As somebody mentioned at the very beginning of this, someone had a very snowy background. They're like, well, that's more than what we've seen all winter. So this is actually one of the driest. December was the warmest on record. And as you all know, that we have very low snowpack right now. I'm sure that you've seen within the news. I know that newspapers and then also broadcast news has been reporting quite a bit about it. And so, and some of you may also know, is earlier this year, we were actually working with the Aurora Health Alliance in order to have more of a bridge between us and between public health community and people who are involved within it. And then we also had Metro Water Recovery, who does most of the water recovery or wastewater treatment for most of the Front Range cities. So the idea behind this is to help to have communities a little bit more understanding about where it is that their water comes from. You know, a lot of us lose track of, you know, where our water comes from. A lot of people just think about it from the moment they turn on the tap. And otherwise, it's just kind of one of those invisible things about how it actually travels to people. And so especially when we go into times where, you know, there could possibly be drought this year, having people have a better understanding of where the water comes from helps to create better stewards in the future. And as I kind of go through this presentation, and I'm going to go through this pretty quickly, you know, please feel free to jump in at any time with questions, because really this is for you. And so Aurora Water, so as you can see within our mission statement, we are responsible for the creation, operation, and maintenance of drinking water, sanitary sewer, and stormwater services. So, all right. So anyway, if you think of kind of a Colorado map, so Aurora Water gets its water from 3 basic basins. So there's the Colorado, which is kind of that mountain area. So around like Twin Lakes, Leadville, roughly Buena Vista area. And then we get another 25% from the Arkansas Valley area, which is kind of like Rocky Ford, if you're familiar with that area. And then we get another 50% from our South Platte system. And so our water comes from about sometimes up to 150 miles. And so obviously that's a long way for water to travel through tunnels and pipes and rivers. And so it takes a lot to actually move water from the mountains to here into Aurora. And so what we've done is we have a very, our portfolio is expanded into a lot of different areas. And so the idea behind that, and to have such an expansive portfolio, is so that we can ensure that if it's dry in one area, that we can get water from another. So as you know, in the mountains, we're not getting a whole lot of snowpack. However, there are things that Aurora Water has put into place that are really important to how we're getting water to Aurora and ensuring that in the future. So the first part of that is water conservation. So I'm sure that there are folks that have been here since like 2003 in Colorado. And so if you're familiar with that kind of time period, we actually had a massive drought. And so Aurora was actually about 9 months away from running out of water. But it was through water conservation efforts and then also some leases that we did that we were able to pull ourselves out of that drought. And so
I have the map up of the basins, if that is helpful for anyone.
Awesome. Thank you, Mandy.
I can find other things too. If you're like, hey, go find this, we'll see.
Yeah, so you can see on here, like this area, right in here for Homestake Reservoir, it's this dark gray area. So that is where we get our Colorado water, our Colorado River Basin water. The Arkansas is a somewhat kind of lighter area. And then we've got our South Platte River Basin, which is about 50%. And so, as I was mentioning, in 2003, we had a record drought. And so, what happened is our director at that time, Peter Binney, and one of our superintendents, they wrote on the back of a napkin about our Prairie Waters project. And then in 2010, it came online, and it's really an incredible, massive project. And so I think that some of you folks may have remembered over the summer, we did a tour of our Peter D. Binney water purification facility. And so that's out here over by the Aurora Reservoir. And so with that, we're able to add another 10 million gallons per day for the amount of water that we're able to treat. And what's really cool about Prairie Waters is that it doesn't require additional mountain supply. It's actually water that's reused. So the water that people use for like showering or for watering their lawns or for doing dishes or laundry, that water actually goes back, it goes through Metro, goes back into South Platte River where it's recaptured by Aurora Water. Then it goes to the Peter D. Binney facility where it's treated at extremely high levels. For those of you who went on the tour, there is a lot that's involved within that treatment process. So it's water that we already own, and then we're able to use that to what we call extinction. So we're able to use that water over and over and over again. So it's a really amazing process, and it's one of the few that are here in the United States. When we first built it, it was something that was being used primarily in Europe. And I think there was one other place in Ohio at that time that was actually using the same technology that we are for this. So water conservation is also really important because through water conservation, as I mentioned, that was one of the ways that we were able to get out of that drought that we had in 2003. So of the Aurora population, as everybody knows, it's grown exponentially. And however, even though with that growth, our customers are using 30% less water than they did in 2003 and 2005. So conservation is really kind of a community engagement project. And so it's really something that all of us have really undertaken in order to use water in the wisest ways. And so the other part of conservation, as I mentioned, within the Prairie Water system, that's kind of our reuse. And so in addition to the reuse that we do through Prairie Waters, we also have what's called the Sand Creek Reclamation Facility. And so what they do is during the summer, they actually take some of that wastewater, they treat it to, it's not quite to drinking water levels, but it is to standards where they can use it for watering. So it's used to water things like medians, golf courses, some of the parks throughout Aurora. And then also at the Aurora Municipal Center, you may have seen that big front yard area. And then also our demonstration garden, that's all reuse water that we use. So it's much cheaper and it's much easier for us to get that to these certain locations. We can't expand it because this was built in kind of 1968. It cost a fraction of what it would now to try to expand that. If we were trying to do something such as Sand Creek right now, it would be almost impossible because it's such expensive technology to do. So along with that, the other thing that we kind of couple this with is storage. So as you can see throughout this map, we've got 12 reservoirs and lakes where we store our water, and those are kind of savings accounts for the future. And so one of the things that we're proposing right now is building a new reservoir, which is called Wild Horse, which is kind of located outside, it's in Hartselle. I don't know if folks are familiar with Hartselle. Before I started working here and before we started talking about building it, I had no idea where Hartselle was. So it's kind of outside of the Buena Vista area. It's close, yeah, so you're kind of pointing to it. So we have our Spinning Mountain Reservoir. So it would be located over here off of 285-ish. And we're still in permitting for this right now. So it's not something that would come online for quite some time. I probably won't even be here when it starts being built. I don't mean that in a not on this earth type of way, but here at Aurora Water. So with those three things that are coupled or that are kind of intertwined, so our water conservation, our reuse programs, and then also with what it is that we're doing for planning for water storage, we're much better positioned than we were in 2003, for example. And then we also, because water quality is such an important part of what Aurora Water does, we actually have about 85,000 tests that are done system-wide every year. And then we have a water quality report that we have that's available every year. So for example, our one for 2025 is up on our website, and that lists all the substances that are in our water, where our water comes from, how that water is treated, and what different levels we have for things. So it's an important kind of community engagement that we have within our system to let people know more about our water. So as we kind of move through, just even under normal conditions, we're planning on doing a lot more engagement with communities and with folks so that they have a better sense of where their water comes from. Because again, this is a public health issue. If having clean, reliable water is integral to not only our health and safety, but also to our industry and to every part that our lives really kind of touch within it. So we're going to be having some additional tours that'll be coming up this year. And we'll have some information that'll go out to Aurora Health Alliance members. And then if you want presentations, if you're interested in presentation, if you have community events, one of the things that we're going to be doing is expanding our community event portion. We have some folks that we're hoping to get online this year. So to be able to go out to some different events and to talk to people. So always feel free to contact me and let me know if you have any interest. And I'm always here if you have questions as well. And with that, does anybody have any questions right now?
Thank you, Rory. I have this bothers me so much now when I go into a restaurant and there's a sign in the restroom like things to flush, things not to flush. I remember there's 3 Ps that you can flush from our tours.
Yes.
The 2 are the things that come out of you, and the other one is toilet paper. Three
Right.
Ps, correct? Not
Bodily
extra
fluids.
hair from your hairbrush, for example. I don't
Exactly.
know who would possibly do that, but
Well,
uh
it's actually I actually have a really funny story from a coworker who was telling me about at Thanksgiving. He had worked here for a very long time. And it was after Thanksgiving and they were cleaning up and he noticed that the turkey grease wasn't there. And so he asked his wife what had happened to it. She's like, oh, well, I know it couldn't go down the kitchen sink, so I just flushed it. And this is somebody who's been here for a really long time. And I know he's had those conversations, with family members. And so he's like, it all goes to the same place. Yes. And so, non-flushable wipes, they might call them flushable wipes, but they are not. There's actually legislation in Colorado that's taking place. I think it goes into effect this year, in which all of those wipes need to be labeled as non-flushable. So when they say that they're flushable, they're lying to you. Please don't do it. It's going to cause expensive backups. And that's the gross part of my presentation.
I brought the gross for you, don't worry.
Oh, that's okay. I'm here for it.
I highly recommend taking them up on the tour offers that will happen later this year. It was fun. It felt like a field trip, like from elementary school, but for adults, it was great.
Yeah, it is really fascinating too. And that's one of the things we always joke that nobody plans a career in water, but once you're in it, you're in it. You just become kind of a water nerd and very excited about all of these different things that are related to it. All right. And thank you everybody for your patience for my non-presentation presentation.
Thanks, Rory. And there is a question in the chat. Do you know anything about Adams County water getting impacted by forever chemicals from Denver? What protections are in place here?
I'm really not as familiar with what it is that's happening within Adams County with with PFAS, more or less, and the forever chemicals. So one of the things that you can do, as I mentioned, we have a water quality report. All water suppliers are required to have that report. And so you can go on and find out specifically about your water provider. In last year, for example, we were required to have information about PFAS. And so I would check with what it is that your water provider has available on it.
Thank you.
And I see Cheryl had another question as
Yeah.
well. About what can people do to test their water. To get your own personal water tested can be extremely expensive. Again, I highly suggest you contact your water provider. Sometimes they will offer to have the test done for you for free, especially if you have really big concerns about it. It really depends on who that provider is.
Great, thank you. Val, I see your hand up.
Hi, sorry, yes. I was debating whether or not to ask this question because it feels a little silly. But I've never found anybody else to ask. But so
Never a
I've been
silly
to,
question.
yeah, thank you. So I've been to Aurora Pride a couple of times and as you might know, it happens at the Aurora Reservoir.
Mhm.
And the two times that I went, there was this sort of rumor amongst the community where people were saying that we were not supposed to get in the water because it had E. coli. And so some people think that that's like not real and it's like just a rumor, and some people think it's true. So I'm just wondering if you know of anything about
I
this. Is it
do.
true? Is it not?
Yes.
Thank
Yes. So,
you.
like I said, we are required to do thousands of tests per year. And so, especially during the summer months, for some of our in-town reservoirs, such as Aurora Reservoir and also Quincy people can't get in the water anyway, so it's not as much of a concern. But at Aurora Water, and especially after there are really big rainstorms. So what happens with rainstorms, things such as, anything, it's that non-point source pollution. So basically, it rains, all of that rain goes into reservoirs or streams that are leading into the reservoirs. So a lot of times that can be things such as, from waste from wild animals, geese, or even pets. So picking up after pets is a huge issue within Colorado. And so what that does is that sometimes that can cause nutrient loading. And so with that nutrient loading, there can be E. coli that's detected. And when we do have E. coli that's detected, they put up signs at the Aurora Reservoir letting people know. And then we also have information that's up on our social media. So to let people know that we have had something, it usually clears up within like a day or so afterward, but it's not something that is harmful. I mean, we're not having detection levels after those periods. So like I said, it's really hot, and when it's really dry, and then all of a sudden we get like a big rainstorm, that can sometimes cause that E. coli within the reservoirs. So when we don't have those warnings, I would absolutely go out there to Aurora Reservoir and get in the water.
Good question,
Thank you
Val.
so much.
Yeah, that was a great question. I'm glad you asked it.
Thank you.
Rory, thank you. Really
Yeah,
interesting.
absolutely.
Yeah, I love that, public health includes so many different things, and I think sometimes we overlook the water that we use every day and where it comes from.
Right.
So I think it's super helpful to have that connection. So thank you
Yeah,
so
and we used
much.
to often refer to it as the silent utility because really, until people have an issue, they really don't think about it.
For sure. Yeah. Yep. Well, thank you. Thank you. Hopefully we'll get
Yeah.
some needed water and moisture over the weekend. Fingers crossed.
Yes. We'll
Probably won't
love
be
for some
enough,
snow.
but something. Thank you so, so much. And just wanted to give you all a quick overview of upcoming meetings.
Thanks, Joe. So in 2026, our plan is to continue with our unhoused work group, our Aurora Smiles, which is oral health work group, and then continued work with our access to specialty care group. That group, as you may know it, is going to meet quarterly for sharing resources, what key stakeholders are doing in the specialty care space to improve access. and then specialty care groups on a monthly basis. We're going to dive into help answer the question, what does a Medicaid patient do when they get a specialty care referral? And we're going to meet monthly and actually get work done, hopefully like a guiding document on what patients or care navigators can help do to move that referral into actually being seen by a provider. There are some, some life hacks, some secret things, some key guidance that I hope that we're going to uncover to help patients in this space. All right, our next, so 3 work groups. Can you go to the next slide, Joe? Here we can, again, there's access to specialty care, Aurora Smiles, and unhoused. You can use this QR code. We're just getting our planning committee together for the next kids convening, which is typically in the fall, hosted by or at Children's Hospital Colorado. So we're also looking into that and trying to find spaces in 2026 that we can move the needle forward in terms of access to care. As always, thank you to our affiliates and for helping support us.
Thank you to Kate, Giovanna, and Rory. Thank you for presenting all the great information and the work you do. Yeah, we look forward to seeing you all at our next quarterly community meeting, which is in April.
Third Thursday of April.
Third Thursday of April. Thank
Yeah.
you, Mandy.
You're welcome.
And thanks all, and stay well. Thank you for being here.
Yeah.
Thank you so much.
Thank you all. Thanks for having us.